Trypanosoma brucei, African sleeping sickness, including the diagnostic features, clinical progression, and treatment. Each question comes with full explanations for the correct and incorrect options. Question 1. Clinical presentation. A 34-year-old man who recently returned from a safari trip to sub-Saharan Africa presents with intermittent fever, generalized lymphadenopathy, and increasing daytime somnolence. Physical examination reveals bilateral cervical lymphadenopathy. A blood smear shows flagellated protozoa. Which of the following is the most likely diagnosis? A. Plasmodium falciparum, B. Babesia microti, C. Trypanosoma brucei, D. Toxoplasma gondii. E. Leishmania donovani. Correct answer C. Trypanosoma brucei. Explanation: classic signs: African sleeping sickness caused by T. brucei. Transmitted by the tsetse fly, early hemolymphatic phase with recurrent fevers and lymphadenopathy, followed by CNS invasion, somnolence, coma. Trypomastigote seen in blood smear. Why not the others? AP falciparum, irregular fever but not associated with somnolence or lymphadenopathy. B. Babesia, transmitted by ticks, no CNS symptoms. D. Toxoplasma, typically affects immunocompromised with ring-enhancing CNS lesions. E. Leishmania, causes visceral leishmaniasis with hepatosplenomegaly, not CNS symptoms. Question 2. Diagnosis. A 40-year-old aid worker in West Africa presents with lethargy and recurrent fever. Peripheral smear shows flagellated organisms in the blood. Which characteristic of Trypanosoma brucei helps it evade the immune system and contributes to the relapsing fevers? A. Intracellular replication. B. Polysaccharide capsule. C. Antigenic variation. D. Spore formation. E. Molecular mimicry. Correct answer C. Antigenic variation. Trypanosoma brucei undergoes antigenic variation of its surface glycoproteins, which allows it to evade host immune detection, causing recurrent fevers. Why not the others? A. Intracellular replication, more characteristic of Leishmania or Toxoplasma. B. Capsule. Cryptococcus has one, not Trypanosoma. D. Spore formation, typical of fungi and bacteria, not protozoa. E. Molecular mimicry, seen in autoimmune phenomena like rheumatic fever, not the main mechanism here. Question 3. Treatment strategy. A 29-year-old woman with African trypanosomiasis is diagnosed with Trypanosoma brucei gambia infection. She presents with signs of CNS involvement, including altered sleep-wake cycles and confusion. Which of the following is the most appropriate pharmacologic treatment? A. Tinidazole, B. Metronidazole, C. Suramin, D. Amphotericin B, E. Melarsoprol. Correct answer E. Melarsoprol. Explanation: for CNS involvement, late-stage African trypanosomiasis, the treatment of choice is melarsoprol. For early-stage blood-borne disease, Suramin is preferred. Mnemonic: I sure am mellow when I'm sleeping. Melarsoprol for sleeping sickness CNS. Why not the others? A and B. Tinidazole metronidazole, used for giardia, trichomonas, and entamoeba. C. Suramin, effective in early disease only, does not cross blood-brain barrier. D. Amphotericin B, antifungal, used in cryptococcal meningitis or mucormycosis.